Now, this story is actually coming out of Atlanta, of all places. Now, there's a Dr. Dare Adewumi. He said he was thrilled when he was hired to lead a neurosurgery practice at an Atlanta area hospital near where he grew up. He says that he quickly faced racial discrimination that ultimately led to his firing and preventing him from getting a permanent work elsewhere. He said his lawyers and other advocates say he's not alone, that black doctors across the country commonly experience discrimination ranging from microaggressions to career-threatening disciplinary actions. That biases, consciences, or not, can be magnified in a fiercely competitive hospital environment, they say, and the underrepresentation of black doctors can discourage them from speaking up. Now, they say too many of us are worried about retaliation. They say, what happens when you say something? Dr. Rachel Villanueva, president of the National Medical Association, which represents black doctors. He said, we have scores of doctors that are sending us letters about the same discriminatory practices all the time and seeking our help as an association that can fight that. Now, listen, I tell y'all healthcare workers this. I've always told y'all could send me your emails. Let me know what's happening. You ain't got to put your name on it. Just let me know that who you are. I'm not going to expose you or nothing like that. We want to know what hospital is doing it. We want to know what's going on in these hospitals so we can tell other black people, hey, avoid this hospital because they have racists at this hospital. Understand? Whether you're a nurse, whether you're a doctor, whatever you may be, let us know. Please let us know. I mean, we will not, reveal who you are. Now, say, according to the Association of American Medical Colleges, black doctors make up 5% of active physicians in the U.S. in 2018, and the most recent available is that people who identify as black alone represent 12.4% of the total U.S. population, and say, according to the 2020 census. And say, for the 21-22 academic year, 8.1% of students enrolled in medical schools identify as black alone. And say the Medical School Association and National Medical Association in 2020 announced an initiative to address the scarcity of black men in medicine. And said they make up only 2.9%. And say of the 2019 to 2020 enrolled students. That doesn't make a bit of sense at all. We need more black doctors, male and female. We need more black doctors. We don't need no more rappers. We got enough. We don't need no more ball players. Listen, I love sports, but we got enough. We need doctors. We need that. That's very important. Doctors are part of what you call the people you need to nation build. You understand? You got to have doctors. Now, I said the American Medical Association is the country's most largest influential group for doctors, is also trying to attract black students to medicine, working with historically black colleges and universities and helping secure scholarships. They say we're trying to put our money where our mouth is on this, and our actions where our thoughts are. He said, but acknowledging that, among other things, the shortage of black physicians contributes to poorer health outcomes for black patients. Yes, because we know how the other people, especially that Mzungu, feel about us. They bring their biases to medicine. They say some black doctors who believe they've been mistreated are speaking out. So Adewumi, he's 39. He filed a federal lawsuit in September against Wellstar Medical Group and Wellstar Health Systems, alleging employment discrimination based on race. He said if they don't like him, that's one thing, but you can't penalize someone according to the law based on race. And that's the exact thing that happened to Dare. He said, and that's what many high-skilled, highly trained, highly credentialed black American doctors are experiencing in this country. Now, Adewumi said some of his surgical decisions were questioned, and he was placed on performance review plan steps he says was a pretext to pushing him out. He said he had previously an unblemished record. And his white colleagues didn't face similar scrutiny. No, they're not going to face similar scrutiny because this country was built for the white man. It wasn't built for the black man at all. It wasn't. The only land that's for the black man is nations that black people run. Whether that's in the Caribbean, whether that's in the continent of Africa, okay? If it's not those places, it wasn't built for black people, especially this place. Like I try to give y'all the harsh reality of that. And you know what I'm saying is true, but some of you, I don't know, some of your mind thinking that you just gonna the white man just gonna just give you America and you gonna just inherit America and you gonna live this awesome existence. That's not gonna happen. Well, the white man in how he feels about us, he'll destroy this place before he let you have it. That's for sure. He did the same thing in the continent of Africa in French. When they had to give up control, they started destroying the place. So you think that's their cousins. Now the brother said he worked so hard, had done so much to get to this level, and all I really wanted to do is help sick people. He said, and here I was having that taken away from me for no reason other than my skin color. Now, of course, it said well-starred. It said it does not discriminate. It said Dr. Awumi has not been the subject of discrimination or unfair treatment. It said patient care and safety are well-starred's top priority. The same old. It never changed. You have a Dr. Stella Sifo. It said HIV specialist among a group of past and present employees at the Arnhold Institute for Global Health at Mount Sinai in New York City, who in April 2019 sued alleging SEGs. It said age and race discrimination. Some claims have been dismissed, but others are moving forward. It said Safo's claims focus on gender discrimination, but she said that as a black woman, race and gender discrimination are intertwined. It says since filing the lawsuit, she heard from a lot of people similar stories. Now, she said that the other brother's allegations don't surprise her. She says what many of us has gone through directly. She said, speaking out, she said, it has been terrible. He said, and adding to, she risked her career and lost friendships, but she felt vindicated by the changes. He said, the New York City Council last year passed legislation to create an advisory board to examine racial and gender discrimination in hospitals. Now, it says Judge Seal Adewumi's lawsuit and some filings in the case at the request of Wellstar which cited confidential information. The filing account of what happened from an interview with Adewumi and a complaint he filed with the Federal Equal Employment Opportunity Commission, which in July granted him permission to sue. Okay? So this brother, it just going through it among a lot of other people, just going through it, that it don't matter what you do in America. We talking about doctors here. Doctors that went to school a long time, went through residency and everything. This brother was a neurosurgeon. Okay, you got to be real sharp to be a neurosurgeon. And he going through this for the simple color of his skin. Why? Why? You know what I'm saying? Why? These people are not going to change, folks. These people are not going to change. If I was a doctor, and of course you can move around or whatever, man, look, South Africa has one of the best healthcare systems on the African continent. If I had that much problem with them people, man, I'd go holler at them in South Africa and say, look, I'm a neurosurgeon. I just want to practice medicine. Man, what could I do to get on? You know what I'm saying? Trust me, they would take him. They would take him in South Africa or wherever he want to be. Shoot, he may even go to the Caribbean if he want to and become a doctor. They'll take him. There's a lot of people that'll take that brother, and I think y'all brothers and sisters need to expand your options. Don't deal with that racism. And like I said the other day about the other story I done about the nurse, when you see too much racism going on, don't try to be the lone warrior and fight everything when they dogpiling on you. Sometimes you got to move around. Sometimes. I know it's not nothing you want to do, but it's best you move around than let them people get caught up with you. You know what I'm saying? And try to mess your license off. Don't ever let them people mess your license off. That's the last thing you don't want them to do. It's better to quit than to let them, get your stuff suspended or get them put some charges on you. No, but this is what our black doctors have to go through. And they're only a small percentage in this country at that. Racism, I told you, white supremacy is those people's culture. They can't help themselves. I mean, it shouldn't matter about the color of somebody's skin, being a doctor. All it should matter is how smart and how knowledgeable that doctor is. Don't matter about somebody's color. But these people, like I said, they are so much full of the devil. They're full of the devil. Everything with them got to be a color. It can't be how smart the doctor is, how wise they are. No, it can't be that. That's what I'm saying. These people don't fit to lead anything. And this is why this country is in the trouble it is, because it don't matter if it's a Democrat or a Republican. Them people aren't fit to lead anything. Because when you see everything with a freaking lens of skin color, you're not even utilizing the smart people that you even got in your own country.